Waterloo scale.
What you need to know.
Hello everyone and welcome back to the Functional OT. Today I'm so excited to introduce you to one of the Australian top occupational therapists, Claire Butkin.
Thanks so much for inviting me along today. It's great to be here in one of your awesome videos.
Claire is not only an exceptional OT, but also the creator of Your OT Tutor, a platform dedicated to supporting OTs in the journey towards growth, learning and professional excellence. In today's video, she will guide us in having a more comprehensive understanding of the Waterloo scale, a tool that, while widely known, is not always well understood by everyone. Let's start with the first question. Claire, what is the Waterloo scale and what is its primary purpose in a healthcare setting?
So the Waterloo scale is a tool used in healthcare settings to assess an individual's risk of developing pressure injuries. So a pressure injury is also known as a bed sore, pressure sore, or pressure ulcer. But basically, it's a wound that develops as a result of sustained pressure or shearing forces on specific parts of the body, often in people whose mobility is limited in some way. So these ulcers are quite painful, they're difficult to treat, and they can lead to serious complications, so it's super important that we take them seriously. The Waterloo scale was actually developed back in the 1980s by Judy Waterloo, who was a British nurse educator. But it's still one of the most popular tools used in healthcare settings around the world today to identify people who are at risk of developing pressure injuries so that preventative measures can be taken.
How does the Waterloo scale assess a patient's risk for developing pressure ulcers?
So the Waterloo scale assesses a patient's risk of developing pressure injuries by considering various risk factors related to the person's health, mobility, and overall well-being. The scale assigns scores to specific criteria, and then they're added up to a total score which determines the person's risk level.
Oh, nice, thank you. What are the key factors and categories considered in the Waterloo scale assessment?
I'm glad you asked. The scale assesses a range of risk factors, all of which are known to contribute to someone's risk of developing pressure injuries. So you can check out the scorecard to see all the different criteria, but some of the factors are the person's BMI or body mass index. So someone who's underweight or overweight is at an increased risk of developing a pressure injury. Age and gender are also considered. So if you're an older adult and you're female, unfortunately, you're going to be at a higher risk of developing a pressure injury. It also considers malnutrition, such as whether the person doesn't eat well or perhaps has lost some weight recently that was unexplained, because this will impact the health of their skin and the underlying tissue. Incontinence is included as well because it contributes to increased moisture around the person's skin, and this increases the risk of skin breakdown. And then there's the obvious one, mobility. So where the less mobile a person is, the higher their risk of developing a pressure injury, and they'll get a higher score allocated on the Waterloo scale. There's also a special risk section for people who have things like neurological impairments or maybe who have undergone recent surgery.
That is also clear. So many details. And what is the significance of the score assigned to a patient based on the Waterloo scale assessment?
So when you complete the scale and you add up the scores for the individual risk factors, you get a total score. And then this will correspond with the person's level of risk for developing a pressure injury. So their score and level of risk is helpful to know for a variety of reasons. So the risk level will help guide what preventative measures we might take, such as what equipment like cushions or mattresses we might use to protect the person from developing a pressure injury. It can also be an objective and consistent way of communicating about someone's pressure injury risks across different disciplines or healthcare facilities, or even in reports or funding applications when you're applying for funding to pay for some of that super expensive equipment. And it's something that should be performed regularly, and then if you do that, then you can track the person's changes in their risk level over time.
How is the Waterloo score calculated, and what is the scoring range?
Each individual factor is scored, and then these scores are all added up to a total score. The higher the score, the higher the person's risk of developing a pressure injury. So if the person scores less than 10, then they're not really considered to be at risk of developing a pressure injury. If they score between 10 and 14, they're considered to be at risk, but that risk is fairly low. Between 15 to 19 is considered high risk, while 20 or greater is considered to be very high risk. And I'll tell you about what we might do for people at the different risk levels a little bit later in the video.
Now, would you mind to tell me who typically performs a Waterloo scale assessment and how often should it be conducted for a patient?
So Waterloo scales are generally completed by health professionals, so especially nurses and occupational therapists. There's not really a set frequency for how often the Waterloo scale should be conducted, as it does depend on the healthcare setting, such as if the client's in a hospital or a community setting, and also the person's individual risk and whether their condition is fluctuating or changing. So for example, in an inpatient hospital setting, they're often done once a week. But for someone with a disability whose medical condition or function is quite stable, it may just be completed by the OT every few months whenever they do a check-in visit. Bottom line is, the person's health and function needs to be monitored, and if this changes, that's when the Waterloo scale needs to be recompleted.
Awesome, this is a great example. Now please tell me, how can healthcare professionals use the Waterloo score to guide care and prevention strategies for patients at risk of pressure ulcers?
The level of pressure care education and preventative strategies that we use can be guided by what score they get on the Waterloo scale. So if they're at risk but scoring less than 15, all they may need is some education about the importance of regularly moving, eating well, and looking after their skin. Once they're scoring more than 15, they're considered to be at high risk, and this is when regular skin checks become really important. They may need close monitoring of their weight or special continence products that help remove any moisture from the skin, or some cushions with special foam or gel for anywhere where they may be sitting for long periods of time. If they're scoring more than 20, then they're considered to be at very high risk. And this is often people who are very unwell in hospital, or someone with complex physical disabilities who require assistance to do things like reposition themselves in bed. For this client group, we need to prescribe specialised pressure care equipment, including things like air cushions or alternating air mattresses, or wheelchairs that have the ability to tilt and recline so they can shift their weight while they're sitting out in their wheelchair. And this type of equipment is quite expensive, but by using a Waterloo score, it can help provide some objective evidence of what the person's level of risk is to help justify why this equipment is so essential.
But would you mind to tell me what are the limitations and criticism associated with the Waterloo scale?
There are some limitations with the Waterloo scale. Firstly, there is some level of subjectivity when you're allocating scores, and different healthcare professionals may interpret the scoring a little bit differently. Some of the scoring can be a little bit confusing when you're first using it as well, especially that special risk section. And because it is so comprehensive and lists all those different factors, it can be a little time-consuming compared to some of the other scales that are available.
Okay, now it all makes much more sense. Thank you, Claire. And are there alternative tools for assessing pressure ulcers risk?
Some of the other common ones which are recommended in international pressure care guidelines are the Norton scale and the Braden scale. So the Braden scale includes a primary section on whether or not the person has sensation, while the Norton is probably the simplest of the lot, and it includes a section about someone's cognition, which isn't covered separately in the Waterloo. It's important to note though, that the scales for both the Norton and the Braden are actually the opposite to the Waterloo. So in the Waterloo, the high scores mean high risk, but when you're looking at the other two, the higher the score, the lower the risk. So this is why it's really important to state what tool that you're using and the risk level, rather than just stating a number.
Thank you so much, Claire. I'm super impressed. You have been so great. You have been answering my questions amazingly.
No problems. Thanks for inviting me along to be part of your video. Hopefully that does the job for you. Thanks for having me. Bye.
And you watching this video, subscribe, leave a like, a comment, let us know what you think about the Waterloo scale. Super important, don't forget to be kind and smile. Thank you so much everyone, and arrivederci.